Ortiz's benefit is one of the reasons why we're able to be here is through a generous donor, which is why the foundation is involved. But when going back to when we first got the gift, myself and Debbie Green, who's the executive director of the foundation, met with Rufia, and we were really racking our brains as to who to bring in to speak to us. And Rufia was absolutely adamant: you don't do anything unless you have Dr. Ortiz come. And so that's why we have him as his own speaker to do his own show. And Dr. Ortiz is in private practice in Highland, New
Highland,
York.
yeah.
I did a little Google searching today. And you'll have to help me. I know you went to school in Mexico.
I did 3 years down there and then 2 years here in the States.
Okay.
Yeah.
And then and has privileges at Vassar, so you spend time
In St. Francis,
there,
yeah.
consulting at Vassar. So it's kind of a big deal to have him here. We're really excited that you were able to come here tonight, and that we had no hurricanes, earthquakes, or snowstorms to prevent us from canceling this. So welcome, and thank you for being here.
Thank you for the invitation. Can you hear me okay? All right. And would it be possible if we turn off maybe front lights at all, or some lights? I'm not going to need this, right? Because we have the cordless. Oh, I see. I see, okay.
Does that work? Or no?
Let's see. Something went off.
Somehow the lights are connected to your...
Is that what it is?
I don't know.
All right. We'll soon figure it out. We have some very nice slides that we want you to enjoy. And if we can dim the lights out, I think you'll appreciate these a lot more. No, that's much better.
All right, sorry.
I thank Rufia for inviting me. I think we've been phone pals for about a little over 10 years now, and we finally meet. Isn't that wonderful? Not too long ago, actually, I was also phone pals with another office, and I was walking into the hospital, and all of a sudden, the person stopped me and says, looks at my tag, Dr. Ortiz? And I says, yes. Who may you be? I'm at a disadvantage here. I am so-and-so from so-and-so's office. Oh my goodness, for 10 years we've been phone pals and we finally met. Unfortunately, her husband happened to have been in the hospital because of a heart attack. So that wasn't nice, but we finally met. The world is kind of small, but it's nice to be able to put faces to the name. I know her husband well, but this is I think my first time I've actually met you. So thank you for the invitation. I have a passion for diabetes, and part of it is also personal. You see, just about my entire family suffers from diabetes, and unfortunately a year ago, one of my older brothers passed away from complications from diabetes at age 51. So it's something that I hold very dear. And so my patients, I think, do get the impression I'm very passionate about diabetes, making sure my patients do well. I take it very personal. And so when someone sits in that examining room, it's as if it were a relative. You know, what can I do to hopefully advise you to navigate through all the obstacles so that your outcome is a good one? So we're going to talk a little bit about diabetes, the not-so-silent killer. So I'm going to take you through a timeline, and we'll do this fairly quick. But the idea of increased urination and the symptoms that come along with it was already described over 1,500 years ago by the Egyptians. So someone recognized there was an issue, and they were good observants. So scientists were not just good in our era, they were good even back then. They were good scientists, and as far as observation is concerned. So they realized these people were losing a lot of weight. They were also urinating quite a bit. So I don't know how that happened. Maybe they were on a camel expedition and someone said, hey, stop, I gotta go. And then half hour later, hey, stop the camels again, I gotta go. I don't know, but someone was recording, obviously. Now, if we go over to Greece, another physician Ortiz, basically, again, we're going back when, he realized that it appeared that those who had this malady had a sweet urine. How he made that observation, I have no idea. But I choose to think maybe someone noticed that ants came around when someone urinated in a certain spot if they had that sweet urine. But someone, I'm sure, must have tasted it. How can they make that observation without knowing? I am just at least hoping it was their own urine and not somebody else's, obviously. But this is one of the things that was known. As we go through this timeline, we also realize people like Matthew Dobson from England, he was able to evaporate the urine, and he came up with some crystals. Isn't that amazing? People thinking about, well, what is it that these people have? And it looks something to what I guess they thought sugar was like back when. So as we continue, more and more observations were made. They noticed that anyone with this condition did not last very long. Lifespan was very short. They don't say how many, but along comes the mid-19th century French physiologist Bernard Claude. He coined together the fact that the liver and the pancreas had something to do with this malady as well. So we see people building upon others' research and hoping to come up with some sort of answer. Along comes the Roaring '20s. And during that time, you know, we think a lot of the wonderful discoveries and things that we enjoy today just happened recently. Well, they didn't. Actually, back then, if we look well, they had airplanes already. Nice looking cars, not like today, you know, and they didn't break down as easy as they do today. They had nice cars, telephone. Can you imagine? Now we take this for granted. We walk around with this little rectangular apparatus and we're talking to everyone and so forth. But I can remember during my residency day, I get called, it was just a beeper, and I had to find a public phone, put a quarter in, and make that call, right? And God forbid it was my last quarter. Because then I was up the creek without a paddle. Either if I was halfway or close to halfway, I had to decide, do I go back to the hospital, do I keep going home? Nowadays, we take it for granted. We have these phones. But back then, that was a big deal. As a matter of fact, it's interesting. Radios, I mean, talk about them feeling back that, wow, the world is marvelous with all these wonderful, wonderful discoveries. Look at this. That was the blow dryer back then. That's amazing. Now we just, you know, any hotel we go to, can you imagine going to a hotel and, oh yes, we have blow dryers here for your convenience. That was half your room right there. And now they just kind of right on the wall if you needed one. And the radios. But guess what? Around the 20s, with everything that was going on, it was not all song and dance at all. There were some disease processes that were afflicting families. There were families that were looking and hoping for a cure. There were families who were diagnosed or had some member of the family that were diagnosed with diabetes, and they knew that it was pretty much a death sentence. That must have been horrible with all these wonderful inventions. If you were to go downtown Manhattan, the lights, and nowadays, you know, we think everything was just recently. No, back then, the lights, that was very exciting back then. But lurking around here was this thing known as diabetes. And it was definitely affecting many of family members. Then we have some wonderful physiologists, Joseph Van Meering, Oscar Minkowski, and they were able to pinpoint that this pancreas had something to do with it as well. If they were to remove the pancreas from a dog, the dog would develop diabetes. The dog was constantly thirsty. The dog was constantly urinating. And the urine had high concentrations of sugar. Isn't that amazing? So now they're getting closer and closer to coming up with a discovery. And this is when we hear about Banton and Best. And you remember the story. And if you haven't, you can go to Barnes & Noble's, pick up one of those, A Discovery of Insulin. It's a wonderful book. As a matter of fact, it was interesting how they described this one scenario. They're walking through a sanitarium where people are hearing. Now, these, just imagine if you've ever seen anyone basically wither away. Someone who has a disease that there's no cure for. And obviously, if you had diabetes, the only way they can keep you alive, maybe a little longer, is they starve you. So they would look like living skeletons. And they're hearing rumors that someone is coming up with a cure for diabetes. Can you imagine being one of these patients at one of these sanatoriums and just hearing these rumors and seeing your roommate died and maybe someone down the hallway die and people that you develop some sort of relationship with, and little by little they're disappearing and you know that your number is almost up as well. And the doctor from this particular place takes off. He's heard of something going on in Toronto. There's some new discoveries being made. And if I remember correctly, one of the scenarios is the doctor is coming back. There were patients who were lying in their beds, very cachectic, very wasted, no hope. But when they heard that this doctor was coming back, they describe all these patients making their way, some helping others, to that front entrance to hear the words of maybe there's a cure for their disease. And when they would see this doctor and he shook his head, not yet. The disappointment in a lot of these patients, that was their only hope. But guess what? These guys persevered. They worked hard. Charles Herbert Best, one of the physiologists, the young one on that previous slide, people like James Bertrand Collett, a biochemist, J.J.R. McLeod, all these guys worked hard to come up with something. They knew they were that close to coming up with a cure, and they finally did. And when that first vial of insulin came in through those doors, can you imagine the sigh of relief? Hope, finally, for some of these people. Leonard Thompson was probably the first patient to receive insulin. Now, just imagine you being the mother. You're holding your baby. Can you imagine? They tell you your baby has diabetes. And in your mind, you know, my baby's going to die. There's nothing I can do for this child. And finally, they come up with this discovery, and it works. This is the same kid later on after treatment. What a difference. Can you imagine the mother for this child, Eugenia, and again, the same scenario, but then there's insulin. This is a close-up picture. What a difference it made, and it prolonged their life. That's the amazing thing about this discovery. Now, we sort of take it for granted. Oh, we got insulin. But can you imagine back then? But let me tell you, there are people nowadays that cannot afford the insulin even today. Now, I've been running the Vasa Brothers Endocrine Clinic for about 12 years now, and we do this volunteer. We don't get paid for this. This is a way I feel that we can give back to the community. The clinic is set up for Dutchess County residents, those that don't have any type of insurance or way to go to a private office. As a matter of fact, some of my patients, when they lose their jobs, says, listen, don't spend your hard-earned money in my office. Here we have a big overhead. It'd be very difficult for me to work around that, but I run that clinic. You're still going to see me. It's a wonderful setting, and you qualify for it since you have no insurance. The only problem is, maybe a lot of things they get is discount except for the medication. Now, just to tell you how we still take this for granted, I had a patient come in once and we went through the whole thing. At the end, basically I'm telling him, to make a long story short, you need insulin. There's no other way. To see a grown man, 40-odd years old, eyes well up because he was too embarrassed to tell me, Doc, I can't even afford that one bottle of insulin. I don't know if you've ever paid for your own insulin, but it's over $100 for a little vial of insulin. It can go anywhere from $100 to $120 to $130 for that little vial of insulin. I have a baby who's sick at home. It's a no-brainer for me. I got to provide for that child. And I'm doing odd jobs here and there. Thank God we have plenty to share with this man. He says, don't worry. stop by the office, pick up some insulin. I'm always asking the reps for extra, by the way. I always ask them for extra insulin because you just don't know who's out there who really can't afford it. Now, just to give you a scenario here, this man could barely afford even the utilities. The house that was almost paid, they were about to take it away from him. This is how dire the situation was. They even cut his electricity. And someone at least was smart enough to let, no, they can't. You have a baby on a special machine, and this machine can only run if it's plugged in the wall. There's no way they can cut it. There's a law that protects you, and sure enough, finally, you know what he did for that one night that they cut his electricity? He hooked up everything to the car battery so that his baby would be okay. That's how bad it was. This was 3 years ago, friends. It still happens nowadays. We take a lot of these things for granted. So let's just talk a little bit about the pathogenesis, and I'm going to keep it as simple as possible so it can be something that you'll appreciate and learn. But as of now, diabetes probably affects close to 26 million people in the United States. That's about 8.3% of our population. That is a very big number. If we divide into who has type 1 and type 2, well, obviously, type 2 is 95% of the population. Now, type 2 are patients who can still make some insulin. So it's there, it may not work, but they make some. And so they may do okay with oral agents. That's why they're type 2. The way I choose to explain it to patients so they don't confuse, think of a two-way street. Goes this way, comes back this way. Therefore, it's reversible. So if you happen to be in my office and that diagnosis is new to you, I'm going to say, well, I've got good news and bad news. Bad news is you have diabetes. Good news is you have type 2. It's reversible. So I may start you on some medicines. However, it shouldn't be a forever medicine. We're talking about something that potentially you can reverse and stay away from these medicines. Never have to take one of these oral agents. Type 2. Get the picture? So you make insulin, and if you make it maybe doesn't work as well or you don't produce enough, but there's insulin there. However, some type 2s will require insulin. Remember I said they may make it, but it may not work all that well. And if it doesn't work, well, I may need to give you some other insulin. That doesn't make you a type 1. Type 1 is not reversible. And thank God that's only 5% of the diabetic population. It's very, very costly, friends. So we have, if we divide that 25.8 millions, it really divides as such. Diagnosed, maybe close to 19 million people. Undiagnosed, there's 7 million Americans walking around not knowing that they have diabetes. Some of them actually do wind up in my office for some other endocrine issue. And so we run some labs, and lo and behold, I'll ask the questions. Did you know you had diabetes? Well, no, doc. This is the first I've ever heard of it. Oops. Well, let me explain the situation. And then we start talking there. So 7 million are walking around without knowing, and then we have about 79 million that are actually pre-diabetic. At one time, during my training, we would never use that word. It's like saying you're pre-pregnant, right? Well, what does that mean? All right? It doesn't exist. You're either diabetic or you're not. So we used to not talk about that. Now we use it in a way that makes sense to the average person. It means that you have all the components, you have all the ingredients for that perfect storm. It just hasn't happened yet. So you get the picture? Now, if we look at different ethnic groups, if we divide them that way, we see that about maybe 7% would be in the white population, 8% Asians, close to 13% in the black population, and close to 12% in the Hispanic population, if we divide them in percentages here in America. How much do you think it costs? And I'm talking about direct and indirect cost for diabetes. Anyone would care to take a guess on this one? How much are we?
Per year?
Per year. Per year.
10 billion.
10 billion. This guy likes to talk about billions. Are you a banker or something? No. All right, 10 billions. Do I hear anybody else, anyone else wants to take a guess how much we're spending in just diabetic population? Any other guess? 10 billion? Do you all agree? That's a high number, right? That's a lot of money. I mean, can we stretch that dollar that much? Well, I'm going to let you know pretty soon. Let's factor in a few things. If we take those that are undiagnosed, those that are pre-diabetic, those that are pregnant and develop diabetes during pregnancy, then we're talking about $218 billion. You said 10 billion, right? That's quite small next to all of this. That's amazing. Now, if we exclude these, and let's say now we this is actually what's being spent nowadays, without the pre-diabetics and so forth. $174 billion, my friend. That's enough to make the news. That's why it's made the news several times.
That's like measured medical costs?
Indirect as well as direct costs. The indirect would be disability, things of that nature. The direct cost is exactly what's being paid for that service. So you factor in those, and that's how much you're spending a year. We have a solution, right? I'll let you read that one. To cut costs, we have moved the clinic to China. Let's outsource it, right, to China. All right. Now, a lot of patients will ask, well, what makes my insulin not work? If you look at this here, you'll notice that out here we have what's known as a subcutaneous fat, not to be confused with visceral fat. It's this visceral fat here that makes the insulin insensitive, doesn't work as well. You don't hear of too many professional sumo wrestlers with diabetes. Most of them have that subcutaneous. It's right underneath the skin as opposed to around the visceral organs. I have a few other pictures that will explain this a little better. If you look at this here, notice this is what's surrounding all the visceral organs, the red, right? This is after weight loss. You lose all that fat around it. You lose all that fat that's surrounding your visceral organs, your insulin begins to work. Isn't that amazing? Now, this is a good way to view it. Pretty much these two guys here have a similar waist size. A lot of my patients will ask me, Doc, well, how come I'm on the slim side and I have diabetes? Isn't that just for people with central obesity, the abdominal fat? He says, no, not necessarily, because if you notice here, this is a normal, this is a CT scan, basically you're slicing someone in half here, and you will notice that there's very little fat around these organs, right? As opposed to this guy. Now, they may have the same waist size, but this guy's visceral organs are just packed with the visceral fat. So on the outside, they both may be, I don't know, 33, 34-inch waist or something. They look good, whatever. However, one of them has type 2. That's the reason. That visceral fat that surrounds it. Now, this is a boring slide, but I'm going to walk you through it. What this is telling me is that as the visceral fat goes up, the insulin works less and less and less and less. And so this is why the typical type 2, we see that they have that central obesity, and the more you build up that fat, the less the insulin works. If you look at this other slide, what you're looking at is, this is your pancreas producing what it needs to. The pancreatic cells here, known as beta cells, they produce insulin. If your sugars go up, they work a lot more. If your sugars go down, they work less. However, the more weight you gain, the less that works. And here, this is what we're seeing. After a while, you cannot keep up with the glucose. The glucose keeps going up and up and up, and your beta cells that produce insulin, they just sort of flatline out here. They can no longer work. So, you go to the doctor, and then we give you pills. And what are we doing with these pills? Most likely beating this dead horse. You gotta work more. You gotta work more. But this horse is tired. Can't produce any more insulin. It's in its last breath. And we add more pills. And we talk about insulin. People, they panic at the word insulin. Let me tell you, it's terrible. when I hear one of my colleagues saying, well, if you don't behave, we're going to have to use insulin, as if it were a punishment. They should be saying it with a smile. Well, don't worry, yeah, if it doesn't work, we have insulin. Make you think this is good, because it is good. After a while, even if you do everything you want to do, if you've had diabetes for 20 years, it's not going to work any longer. Those pills will just fail you. You haven't failed the pills. These pills will fail you. But thank God we have some insulin. We can correct that. You can still lead a normal life.
Now what caused that bump now? What's the bump on that chart?
That bump happens to be the beta cells. They produce insulin.
Right.
They've been working as hard as you can. Now, part of it is your body compensating for a little while, so they work harder. Or it can be the pills you're taking. They're forcing some of that insulin to be produced. After a while, you can't produce much more. And so you keep taking these pills, nothing is happening. Your sugars are running really high. That's a good indicator. Stop wasting your time and money on those pills. Let's get on insulin and lead a normal life. Make sense? Now, I'm going to skip over this one because we talked a little bit about that visceral. I just wanted to show you this one. This one here actually does show several people here. They all have the same waist size. All of them. But you notice from the first one to the last one the amount of visceral fat. And as that fat increases from slide to slide to slide, the more resistant they are to insulin. Mind you, I mentioned again, they all have the same waist size. So it's that visceral fat that we need to get rid of, and exercise helps tremendously with that. So how do we avoid these complications with diabetes? Because that's what we want to do, right? No one wants to have all these complications, live to be whatever, and yet you can't enjoy life. I remember listening to NPR not too long ago, and they were interviewing a wonderful, very well-known cardiologist who does a lot of research in longevity. And so Dr. Shartak asked him, well, you know, what's really the point? I mean, if you're going to eat right and do everything right and abstain from everything else, how much more will you live than the person who's doing everything correctly? And the doctor said, maybe about 2 extra years. And so Dr. Shartak asked, well, is it worth it then for these extra 2 years? The answer was an absolute yes. There's a difference between, let's say, reaching 75 and still being able to climb and hike up a mountain, and being 75 and you can barely get out of your chair and walk. And every step is so painful. There's a big difference. And I know people like that. As a matter of fact, there was a lady back in California, and I remember reading about this many years ago, how she was diagnosed with a chronic fatigue syndrome, fibromyalgia, and she was about 65. She had just retired. She was thinking of enjoying life from there on, and she can barely walk. That's how painful everything was. So the doctor says, well, you got to drink water, exercise, and here, take these antidepressants, they'll help you. Well, she gave it a try. She was able to walk from the door to maybe the porch, and that was it, and that was with tears. And finally, a week later, she's walking right up to the street, and that was with tears also. And then a few more weeks, now maybe a month, she's walking down the block and back home with tears because she's in pain, but she was determined to beat this. She became very famous. Till the age of 90-something, she would hike up Mount Helen. She beat it. Water, exercise, something simple. She came off the antidepressants, by the way. Very amazing story. She was not going to rock her life away. Now, why the complications? How many of you have ever been stuck in traffic? One of these freeways. You know, I grew up in New York City. I'm from the Bronx originally, and so I know traffic. As a matter of fact, when I was a teenager, I used to work as a messenger. It was a lot of fun. You know, I would deliver these printing thing for the architects, and you would see these beautiful buildings and homes, and just amazing, you know, for a teenager walking down the streets and looking at all this stuff. But when traffic hit, it was horrible. Well, diabetes will cause this traffic in your blood vessels. Nothing can move. You block a blood vessel, and guess what's going to happen? Wherever that oxygen was supposed to be delivered, it's not going to get there. Wherever the nutrients that we're supposed to deliver, it's not going to get there. So what's going to happen? Those body parts will suffer. And this is a good analogy. Have you ever been stuck in a tunnel? That's a little bit scarier. Lincoln Tunnel or something. Nothing moves. If there's an accident, nothing moves. Well, if you happen to have a traffic jam in any blood vessel in your brain, that part of the brain that controls that part of the body will not move. We call it a stroke. Not something that any one of us look forward to at all, obviously. Now, I'm going to talk about this a little sooner because guess what? Diabetics do suffer from erectile dysfunction at a much earlier age than what in the general population. A lot of people like to basically think, well, I'm old now and it's kind of to be expected. No. The answer is no, no, and no. As a matter of fact, I would say about 8 months ago, I had this patient who came in. He was about 90 years old. I thought he was maybe stretching the truth 80 years old. Maybe if I stretched it, maybe he was 80. But he was actually 90. I mean, he looked really young. He was strong, and we're talking and so forth. He's very fortunate, has a son who's very well-to-do and has a beach house somewhere in the Caribbean. And he even invited me. He says, if you're ever in that part of the Caribbean, you know, stop by, please. We'll go out boating. I fish just about every day. Wow, at 90 years old. That's amazing. I wonder if he had a rope on that boat just in case, you know, they can pull him right back. The thing was, he was full of life. Diabetic, doing very well. Then at the end, he asked his wife if she would please leave the room so that we can talk a little bit more personal. And it was interesting. I mean, talk about, this is very nice. For me, as a much younger person, just following in those footsteps, pretty soon I'll be 90, but right now I'm not. He says, Doc, can I just, you know, am I a candidate for Viagra? And I says, well, why wouldn't you be? I don't see that you're taking any nitrates, you know, the nitroglycerin and so forth. You look very young. And are you still enjoying a healthy sexual life? He says, yes, I am, Doc, with my wife. I thought that was the nicest thing I've ever heard in my entire medical career. 90-year-old speaking that way. That's exactly how it should be. But we like to call it, well, I'm old now and so forth and so on. Well, that's not the case. But if you're diabetic, it's going to happen a lot sooner. And the younger folks, we tend to attribute it to, well, I'm stressed, I'm working hard. No, you may have a problem. And it's easily correctable. So don't let it go just like that, friends. Maybe it's a mental issue. Maybe, yes, for some it may be stress. Maybe some sort of psychosomatic issue that you think you have to perform in a certain way and it's not happening. Well, no, not necessarily, but if it is, we can work through that. Maybe you're drinking too much alcohol for the younger, and we tend to think that it doesn't affect us. We all like to use the excuse, well, you know, they say that if you drink a little alcohol, it protects the heart. Well, it damages other things. You have to sort of weigh some things in here. Which one would you rather have, right? Smoking, my friends. Maybe this is the sign we should have. Smoking will affect those blood vessels. There's not going to be any erection for anyone with erectile dysfunction if you're damaging the blood vessels. Diabetes will do it on its own. And then you add the smoking, that's even worse, friends. And the other thing may be medications. Maybe we're giving you medicines that are contributing to it, and we may be able to change some of those medicines. So don't hold back talking to your doctor about these issues. That's what we're there for. This is easily treatable. So do speak to your doctor if you're suffering from this. Now, other ways to improve things. Exercise. Some of my patients will ask me, how often are you going to the gym? If they go to a gym. About twice a week, and they say that with all that pride, I go twice a week and so forth, or 3 times a week. That's the wrong answer. You should be exercising every day. Do you breathe twice a week or 3 times a week? No, every day. Therefore, exercise is a daily routine. It's every day. But we tend to exaggerate things in our own minds. Now, you can either exercise or retire and basically just, you know what, sit in a rocker. Age that way, not enjoy anything. Those are your 2 options, friends. But as far as I know, walking is not taxable yet. All right? So you can walk. No one's going to charge you for that. It's free. I like free things. Don't you? Of course we do. So walking is one of the best things you can do. If you haven't done it in a while, get some good, comfortable sneakers. If you can't afford them, do whatever it takes. Get walking shoes that are very comfortable so that way you don't get discouraged. And then don't try to do a whole mile if you haven't done it in a while. Just walk for 15 minutes at a leisure pace. So let's say, for example, if I'm walking at this pace, just like I'm doing right now, the cord, oh, it's not limiting me. So here we go. So if I'm walking at this pace, uninterrupted, for 15 to 20 minutes, that would be considered exercise, because if I've never done it before, I should be able to pull out my cell phone, I should be able to have a conversation, and the other person on the other end should not be saying, why are you so short breath? I should be able to walk. If I'm short breath and I'm saying, well, wait a second, let me just rest here for a while and I'll answer that immediately, and then you're walking too fast, right? So you pace yourself so you can build it up. As a matter of fact, when I was in high school and college, I was in gymnastics. Graduated from college, everything was downhill from then on. As a matter of fact, 6 months later, I'm thinking to myself, you know, I'm going to lose all my muscle tones. I need to get back to a gym. So I remember going to this gym, and I walked in, and I wanted to join the gym, and the owner was a 65-year-old African-American man, about my height. Now, this man had the body of a 21-year-old. If you didn't see his face knowing that he was a senior citizen back then, because now they're more like teenagers at 65, but if you had no idea, you'd have thought this guy was a 20-year-old. And so I see all these guys pumping iron. You know, the sound of metal when they let it go, feeling all pumped up, all manly, full of testosterone. Oh, yeah, you know, and they're walking around. And so he says, so when was the last time you worked out? I says, that was about 6 months ago when I was in college. 6 months ago. I say, you see those weights over there? Those are the only weights I want you to use for 4 weeks. Now I'm seeing all these guys pumping iron, dropping them, kapoosh. He gave me these 10-pounders, wiki, 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 kapling. That was so embarrassing. All these guys pumping iron. I would go there day after day for 4 weeks, pick up my little 10-pounders, you know, look at the other guys, wiki, 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 drop them, you know, and then, you know. But he was right. What he wanted to make sure was that I would build up good form, good technique. With lesser weights, I could do that, not hurt myself. And then I can gradually start increasing the weight. You hurt yourself, you're not going anywhere. The same with your walking. Start slow. We're 15, in other words, maybe 8 minutes one way, 8 minutes the other, and if that was just one block, so be it. But you exercised. It took you all of 15, 16 minutes to do that. You build it up little by little. And guess what? Before you know it, you're walking several miles every day in maybe those 15 minutes. Isn't that amazing? At least 1 mile in 15 minutes, right? At least. So we should take advantage and do that on a daily basis. One way to realize if you're really doing it or not, don't just mentally keep track. If you exercise, then you mark it on the calendar. You exercise another day, you mark it in that calendar. You exercise again, you mark it in that calendar. Then you can look and say, oh my goodness, I've only been exercising 1 day a week. It's a more objective way of grading yourself. So if you mark it every day, if you're exercising, this is a good way to motivate you.
How do you measure the intensity of exercise? What intensity of
I gave you the cheapest way. You don't require technology. What you do is you walk at a pace that you can actually have a decent conversation without feeling short of breath. Right. What will happen is you'll see guys that actually can walk fairly fast and have that conversation, and I may not be able to because I don't have that endurance, right? So you do it that way. It doesn't require all this fancy equipment. It's just you gauge it by how well can you have a conversation with someone as you're walking. It's a good rule of thumb. Now, I know we have nutritionists, dietitians around here, so I'm going to dare to say something. Hopefully they haven't participated in this part, but I keep hearing some of my patients telling me, you know what, doc? As a matter of fact, this is about 2 years ago. I met this guy from Yonkers, wonderful old Italian man. I said, oh, you know, I live nearby there because I'm a Bronx kid myself, you know, and we think of Yonkers just like a glorified Bronx anyway. And so we hit it off really nicely. And he says, Doc, you know, one of the things that I miss the most is eating pineapples. I said, well, why? Well, 20 years ago, my doctor said, it's a bad fruit. No such thing as bad fruits. No such thing as bad fruits. Some may be more concentrated in sugar, so you eat less of those. But he says, they told me pineapple was bad. That was my favorite, Doc. My favorite for 20 years. Ask my wife, ask my daughters that were there. He says, Doc, whatever the doctor says, it's like God himself, the Pope said it. And he will follow it. So for 20 years, you haven't had pineapple. He says, can I look at that menu? He says, well, they have pineapple on the menu. I want you to order pineapple. His hands were trembling. He started salivating. What? Are you sure, doctor? Of course I'm sure. They're not going to give you the whole pineapple. That's a family serving. They're going to give you a little bit of pineapple. Enjoy it. You mean for 20 years I've not had pineapple because I thought it was a bad fruit? Well, it's just too bad. He didn't meet me 20 years ago, but 20 years ago I was not a physician anyway. So the idea is no such thing as good and bad fruits. But you have to be careful. Most of these things come in nature. You know, the way God, I guess, made them was single-severed. An apple, an orange, a banana, not a watermelon or a cantaloupe. That's more for the entire family. You share it with everybody. Right? That makes sense. If you're going to eat grapes, well, don't eat the whole cluster. Just see how much you can fit in a cup. That may be enough. But I much prefer to see one of my patients snack on a fruit than a Snickers bar. For one, that fruit may have anywhere between 45 to maybe 65 calories. Will give you early satiety, meaning you're going to feel full for a lot longer. Complex carbohydrates. It has magnesium, potassium, vitamin E's, and then whatever else that it may have, it's beneficial to you. And guess what? You're going to feel wonderful. Now, if you're going to snack on fruits, my idea is don't buy a whole bunch of oranges and then just have oranges for a whole week. You're going to get tired. Add variety. Flavor up, spice up your life with a different fruit, different snack. And guess what? You'll never tire of it. Portion is very important. Now, one of the things that I've learned over the years is you can't tell a diabetic, don't do this, because in your subconscious, you're already saying, I'm going to show you who's in charge, right? If I were to tell you right now, please don't look back. There's something happening back there, but keep your eyes over here. Some of you really want to look back. I'm going to show you, and you look back. It's just instinctively. So if I tell you, don't do this, don't do that, you want to do it. That's when you mostly want to do it. So the best thing to do is always offer the diabetic. As a matter of fact, I have studies from Toronto that would say a diabetic can eat anything a non-diabetic can eat. So now if there's any physician, any nurses, Rufia is not going to invite me again. But the reality is that's the truth. A diabetic can eat anything a non-diabetic can't. But let me put it in perspective though, because some of you will hold on to just that little bit of information. Dr. Ortiz says, I can just, do whatever. I can eat whatever. That's not what I'm saying. What I'm saying is any fruit, any food item that a non-diabetic can eat, you can eat as well. I think, this is my personal opinion as a physician, and I share this with some colleagues, whether they agree to it or not, I believe that as a diabetic, you have an advantage if you happen to be diabetic. See, you see a doctor quarterly. So if we see something going wrong, right away the red flags go up. I can tell, take a detour here, take a left here, take a right here, duck. Whatever it is, we can tell you ahead of time. But then along comes Mr. Smith and Mrs. Jones, and they were the epitome of health, and they dropped dead. And everyone is wondering, but they were so healthy. No, they weren't. They were eating everything and anything in their sight. They just looked good, but they were doing all the wrong things, right? And they thought they were getting away with it. And because they were that healthy, well, they saw the doctor once, maybe every 2 years. No one can warn them I was coming. So it finally happened. So as a diabetic, you may have an advantage because we can see these things with the the exams that we do. We can tell you where to be cautious. This is a rough rule of thumb here. Whenever you're eating, and again, it's not a rule per se, but it's a good way to gauge things. At least half of your plate with your vegetables. 1/4 starch, 1/4 protein. But it's got to be a decent, normal human-sized plate. About maybe 9, no more than 11 inches, right? And some of you will go back home and now you're going to go over to wherever you buy your dishes in China. I know, that's too small. I'll take that one. So we got to be careful, friends. We have to be very careful. I like this one. What? It says the serving size is 1 bowl. Right? So we got to be careful, right? Some of us will take advantage of this. Ways to improve your diabetes. Obviously, eating correctly. Now, a lot of diabetics are also on anticoagulants. I have a patient currently. Now, this is going on almost 2 years. When I first met her, I go to this assisted living place, and she was telling me, Doc, the one thing I miss the most is eating salads. So I looked at her and, why can't you eat salads? Well, I'm on Coumadin, and my cardiologist said I can't eat anything green. I says, well, that's not entirely correct. What do you mean? I says, I haven't had salads now for so many years. It wasn't 20 though, but I haven't had salads for so many years. I says, well, how much do you normally eat? No more than a bowl. All right, then I want you to start eating a bowl because I'm going to be checking your levels on a weekly basis and then I'll make some adjustment on your Coumadin until we get it to therapeutic range, but I want you to eat your green vegetables. And boy, for the last 2 years, she's a happy camper. She eats the same amount every day. Her levels are therapeutic. I adjusted them, and she's doing fine. So a lot of times it's just a matter of changing things a little bit, monitoring, and allowing the person to enjoy life like anybody else. Just because you're diabetic, we shouldn't be sucking the joy of life from you. You should be living a life like anybody else, right? So eating healthy is extremely, extremely important. Having proper body weight, extremely, extremely important. So if you happen to be overweight or obese, no better time than, if not tonight, tomorrow to start walking, right? And then you do it on a daily basis. I keep getting a lot of questions on the cinnamon. Yes, it does work. Diabetes Care, this is 2003, and about 1 to 4 grams of, and now they sell the capsules, 1 to 4 grams. It does have the glucose lowering effect. So yeah, if you wanted to add it, that's fine. Go ahead and add it. If you want to sprinkle, I don't know if you can measure that 1 gram easily. I don't know that I would be able to eat that much cinnamon. I think I would lose the taste for it if I had to eat that much. But it does have those wonderful properties. And friends, if you're drinking sugary sodas, substitute them little by little. Start acquiring taste for something else other than sodas. If you realize this is back in the 60s and 50s when the average size of a serving on a soda was what? Danny, you remember? About 6 to 8 ounces. That was it. I still remember those Coke bottles, you know, the nice little. And then we went to the bigger ones and bigger ones. And now the average size is about 32 with your whatever, extra meal, you know, extra value meal, whatever you want to, right? We've become gluttons here in America. And this is actually published. 3 studies at least, New England Journal of Medicine, suggest that soda is heavily linked to the nation's obesity epidemic. Yes, for those patients of mine that have been able to substitute those, they've actually been the beneficiary of losing quite a bit of weight, and they're happy about it. Very simple step, substitute it. I like this one. My dentist says bacon and soda works just as good as toothpaste. That's baking soda. So we always want to make some excuses, right? Not bacon and soda, it's baking soda. It's good for your teeth. Friends, no substitute for pure, unadulterated water. I don't believe that any one of us is looking forward to, I want to age as fast as I can. I want to wrinkle up as like there's no tomorrow. No, No, we want to be able to be as young as we can. We want to stretch that part of our life, being youthful as much as we can. We spend billions of dollars on skin moisturizers and all that, and guess what? They don't work. Why do you think a baby's skin is so nice and soft and stretched out? Because there's more water in that body than ours. But we hear patients telling, I hear it at least, oh, I hate water. Develop an appetite for it. That's the only way to stay young. Doesn't cost that much. The more water you drink, the better hydrated your skin. I mean, I don't look bad for 60, do I? Water works. I'm only kidding. But water works. Pure, unadulterated water. Just as good. Well, how many of you would ever think about showering in coffee? Not hot coffee, obviously, but can you imagine how your skin would feel, your hair, all sticky? You can run to the wall and get stuck right there, right? Well, the same happens in the inside. Just like water is good on the outside, is just as important in the inside. The joints, the walking, many of us who says, you know, my knees are locked up, I can't, I mean, they have an excuse for everything. They won't. The fluid between the knee, it's your shock absorber. If you're not drinking any, well, guess what? It's bone against bone. And then you waste the cartilage there. And the pain, then you're limited. You can't do anything. Drink enough water. Keep those shock absorbers working well. Water is what does that. Things we look for.
Are you talking about 8 glasses a day?
Good question. As a matter of fact, I don't have an 8 glass a day recommendation. I'm going to tell you why. That question comes, I mean, I've heard it all. I've heard that by the time you feel thirsty, it's too late. You've caused a lot of damage to your body. I don't believe that. As a matter of fact, if you work in an office setting, air conditioned, you're not breaking out a sweat, you're only losing whatever you're breathing out, what little is leaving your skin when you go to the bathroom, obviously, that's it. You can replenish that. It won't take 8 glasses of water. If you're working construction out there in the summer where you're sweating, 2 gallons may be what you're going to need, or if not more, because you're constantly sweating. So it depends on the level of activity that you have. I think any one of us here would benefit easily from at least 4 glasses of water easily, even if you're just in an office setting. You need that because your brain floats on water, right? No water, this brain is kind of bouncing around, you're irritable, someone compliments you, and you curse them out. Right? So water is extremely important. Diabetes, why do we take care of it? Because our eyes can also get affected. One thing is to be born blind, another thing is to lose your sight. Very different. How about amputations? The number 1 cause of amputations in America, if it's not a motor vehicle accident or some sort of traumatic accident, it's diabetes. Diabetes, my friends. Your heart. More people die from heart disease in America than anything else. Diabetes will accelerate that. And kidney problems, my friends. We've got to protect the kidneys. The kidneys are the one that filter out all the toxins in the body. So you want to protect them at all costs. Talking about the eye, for example, let me show you a few things here. If we were to look at this cartoon here and we're looking at the back of the eye, you would notice abnormal blood vessels. That's why diabetics need to see their ophthalmologist at least, minimum, once a year. You would notice these things, little microaneurysms, what we call cotton wool spots, which are scars, little hemorrhaging. Now that you've seen that picture, if your doctor sees that, next thing he's going to do is he's going to laser them, cauterize them with laser so that you don't go blind, and it creates these little spots every time you laser them. Now I'm going to show you the real thing. You think this guy got some laser treatment? For sure, all those spots, wherever there was some bleeding going on. You can't see the resolution, it's not good enough. There's a lot of new blood vessels here and microaneurysms. And so that's what they're looking for. Nerve damage. It can be motor, so that you can't walk as well, you can't feel balance as well. It can be sensory. You develop also. This is why we make diabetics take off their shoes, so we can examine and see if they can still sense that filament or vibration. It's very important. You lose that, you're likely to lose a toe, a foot, the leg, and we want you to avoid that. Now, let me show you some pictures because it's easier to let's see here. 10% of patients who have neuropathy will have it at the time that they're diagnosed, meaning the nerves are already somewhat damaged. If you've had diabetes for a long, long time, 50% will develop them within those 25 years of initial diagnosis. In other words, nerve damage. 25 to 33% of them will have the nerve damage with pain. So when they go to bed, they're constantly in pain. It's almost like walking on pins and needles. And it could, this pain, either burning, tingling, shooting, electric-like. It comes in different forms. What happens is, this is a healthy nerve. See the blood vessels feeding the nerve? That's what it should look like. Once the blood vessels, either from smoking or diabetes, become damaged, well, guess what? They don't work very well. They start becoming damaged, and this is what you're left with. A very ugly-looking nerve that doesn't work very well. And this is what you wind up with. Ulcers that don't heal appropriately. That's why diabetes costs so much.
So all of those conditions are vascular related.
Vascular related, that's the one thing. Now, when we look at your feet and legs, many a time, some of you have lost your hair on your legs. You may say, well, at one time I was very hairy, now I have none. Yeah, those blood vessels no longer feed there, hair falls off. We can see that mark, that very clear mark. See from here, still a little bit of hair, from here, nothing. They change, they become very dry. The fungus that develops between the toes. Now this guy's a little bit better. If you notice he has hairs on his toes, that's a good indicator that you have blood flow. So someone has hair, and now everyone's going to be checking tonight. That's good, but if you have hair on your toes, that means circulation is still pretty good. The irrigation system works. The dryness that you see, those sweat glands don't work very well. Nothing is feeding the sweat gland. They're not going to work. Skin dries, cracks, and a nice portal of entry, and you can potentially lose your toe. That happened to my brother. Started losing the nerves. Before he knew it, he lost part of his foot. Within a few months later, he lost his leg. 6 months later, he died. Very, very sad death. These are the ulcers that develop in many of them. These are a little bit more common, so we usually refer you to the podiatrist to see them quickly. Diabetic nephropathy, we're talking about kidney damage. I don't think any one of us would like to spend too many hours in a dialysis center, but that's exactly what's going to happen when we don't take care of our diabetes. You will lose the kidney function, and you will spend 3 hours, 3 days, 3 days per week in a dialysis center to remove the toxins. And I think I'd freak out if I had tubings put all over my chest, seeing my blood. You know, I wouldn't want to see that, but that's his blood going in from one side, coming back clean on the other side. He must have had it for a while because he seems pretty cool, calm, and collected there. I've been freaking out. And then you've seen a lot of these dialysis patients where they develop these aneurysms wherever they have their shunt. This is where you connect so that the machine will clean out your blood. So treat them delicately by doing the right thing. The heart. Obviously, this is just describing a little bit of blood flow here, but same thing. If one of those blood vessels get clogged up, you will have your heart attack. I kind of want to focus a little bit on this one here. The common symptoms: chest pain, crushing, heaviness, in other words, pressure, indigestion. Many times we think, oh, it's just indigestion. If you're diabetic, take it a little bit more seriously because it may not just be that. Women, it's a lot different for you guys. Once you become menopausal, the symptoms are very different. Unusual fatigue, sleep disturbance, shortness of breath, indigestion, anxiety, chest discomfort. It may be your signs of a heart attack if you're menopausal. Not exactly the same as it presents for men. So we've got to be careful. Any questions?
So if you take your insulin, you won't get all those things.
If you take your insulin, you may prolong this. Let me give you an example. Both my grandmothers are alive. One is 94, she's independent, she lives on her own, she still enjoys cooking, she is completely there. The other one is 90 years old, she's got diabetes. She's had diabetes since she was about 50. And she's 90 years old and still doing okay. Now she's getting basically a lot of these complications because of the diabetes, but you can prolong. She's already had 4 vessels bypassed, quadruple bypass, 2 pacemakers, but her kidneys are still working. She still has her vision. She has both legs, 90 years old. So that tells you you may develop some other issues, but you can still enjoy life. She's still independent. So it speaks for itself, doesn't it? Any other questions? Here and then here.
Is it considered like so many other things that it's possible this hereditary, it might run through a family?
It tends to, if you have a strong family history, I think we looked at things very differently. For example, if your sugar is slightly elevated, now we make the diagnosis with a 126. But let's say anything under 100 is normal. You happen to be 110. And a sibling has diabetes, or mom and dad had diabetes. Then I'm going to take that a little bit seriously. I may want to do a 2-hour glucose test. So I send you to the lab, they draw blood, they give you syrup to drink. 1 hour, 2 hours later, I see how fast you can break this and eliminate it. If you're still high, higher than 200, you have it. Yet, it was only registering initially as 110. Not high enough to call it diabetes, but you had it. It's different. Someone who has no history, I may do that, and yet they're able to get it down to normal within 2 hours. So I just kind of keep an eye on that person. They don't have it. But there are a lot of patients that will, especially when there's a strong family history.
I was just diagnosed like a month ago with sugar of 120, fasting 125, and A1C of 6.5. So I did a little research, and the doctor said, "You want medicine?" I said, "No, let me try diet." And I tried cinnamon, and I do it regularly, 3 times a day for 1 month, and I've lost 8 pounds.
Wonderful.
Now, should I be measuring? Should I,
I would definitely,
if
your primary may be sufficient at this point in time, but I definitely would be checking my fasting glucose every day, and occasionally I would do what we call postprandial, fancy word for saying 2 hours after you finish your meal, check the sugar. Let's see how fast you dispose of this sugar.
But how do I know how fast I should dispose of the sugar?
Within 2 hours, the magic number that I'm looking for is 160 or less. If 2 hours after a meal, you're running much higher than 160, then whatever you're doing may not be enough. However, as I mentioned, if I had just diagnosed you, you said what, a few weeks ago? A month ago.
Yeah.
All right? So a month ago, that means you probably had diabetes already for about 5 years. It's just been there, it's just running right under the radar. So it was, very difficult. So you would be the wonderful candidate. I'd be saying, all right, the good news is, remember the two-way street, this is reversible. Walking plus what you're doing may be sufficient to reverse this once and for all, to keep it under control and never even have to take medications and do well. So that would be my goal. That's the goal that I would set for you and say, all right, every day you're going to walk, try to keep a good diet, portion control. So I'm not saying you can't eat this, you can't eat that, portion control. Now with Thanksgiving coming up, portion control. So enjoy a little bit of everything. My wife and I go out to eat, and just the other day we share a dessert. Now, she's not diabetic, I'm not diabetic, but I'm very high risk. My mom is diabetic. As a matter of fact, this is not funny, but I was just joking with my sister. Just before I left the hospital, I had 4 consultations to do just before I got here. So I'm going through this, and my sister calls and she sends a message, please call mom, she's crying, she's not feeling well, da, 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 da. So I call her instead. All right, Shirley, give me the skinny of it. What's going on? She lost all 3 front teeth she had, just like that, biting into some food. And so she's all upset. And obviously, I would be too. Can you imagine? I would probably not be doing this lecture if I lost my 3 front teeth. I'd be wearing a surgical mask. So I was joking, well, meanwhile, until she can see the dentist, let's get some chiclets. All right? And so I was joking with her. No, this is no joking matter. I said, no, I know. It's devastating, obviously. But diabetics will not heal very well. Gums, this is why we look in your mouth. Let's see if there's any periodontal disease or something like that. Let's make sure you're doing well, because diabetes has a way of causing problems if it's not properly treated. But you treat it well, guess what? You're going to do very nicely for a long, long, long time.
So you say I should be measuring, so I should get it.
Every morning you should be checking at least your blood sugars. Every morning. Fasting.
What does it use to measure? We don't have anything.
Glucometer. Have your primary definitely write you for one. Or they may have 3 ones in the office. Back here? Yes. And then the lady next to you.
Is it the fasting blood sugar should be 126? Is that or under?
The fasting, a normal fasting blood sugar is under 100 at all times. So 99 and below is completely normal.
Talk a little bit more about neuropathy.
Talk a little bit about neuropathy. Neuropathy, again, what we mentioned is nerves that are damaged. Notice how the blood vessels that feed into this are very tiny blood vessels. If they get all clogged up, that blood vessel will not bring in any nutrients, will not bring any oxygen to that tissue, the nerve. So it dies away. No longer can you perceive pain. Now, I didn't have any gross pictures about Charcot joints. This is a person whose nerves are so damaged they can fracture their ankle, not know it, and just keep walking on that ankle. And it just keeps fracturing and fracturing and fracturing. It never heals completely, so it heals in a very deformed way. And before you know it, they're compensating by the way they walk and more damage. They've no sensation of pain whatsoever. Just to give you an idea, now this is going back 12 years ago. I had a patient who was about 80-odd years old, and I was just leaving the office. And my office at that time was right in the building of this assisted living place. It was separate from it, but in the same building. And so she comes in with her walker. Dr. Ortiz, please, before you leave, I've been having pain in my foot all day long. And can you please examine it? I said, sure. So we went right back to the office. So I took off the one shoe to look at the good one. And as I'm taking the shoe where she's having the pain, guess what I found? Take a guess. It was stuck in her. A nail, what else? A rock, a needle, a pin. It was the metal shoehorn she was using. Sideways, cut right through the flesh and bumping into the bone. So I had asked her, when did you put on these shoes? Just before breakfast. Breakfast at this facility was at 8 in the morning. That meant that from prior to 8 o'clock in the morning till when I saw her, which is now about 5:30 in the evening, she was walking, and this shoehorn that she used to put her shoe in was there, cutting away. She did lose that leg, and unfortunately depression got to her, and I think she died a few months afterwards just because of that alone. And she knew it. She says, Dr. Ortiz, if I lose my leg, I know just the thought of it, of not being able to walk again, will kill me. And she was right. So this is what nerve damage does. So you have no idea. When we check with that little filament, it's not a needle, it's just a little thick hair that we press against the toe, the big toe mainly. If you can't feel it there, you're in trouble. It means I don't want you walking barefooted, because if you get cut, you won't know it. That also means that every night you look at your feet. If by any chance you have central obesity that does not allow you to bend, you take a mirror. And if there's someone else at home, have them at least just check my feet. Just make sure that nothing is there, right? That's why it's so important. So once you lose that, it's lost forever, pretty much.
Yeah, I'm thinking more about, you had a slide back there that you went over very quickly, the pins and needles and the prickling and the pain.
Initially, that's how it presents. So the patient may describe something like, every night when I go to bed, that's the only time I feel this, like pins and needles, or sort of like electricity shooting through my feet. Sometimes there's a remedy for that because some patients use metformin. How many of you are acquainted with metformin? It's a wonderful drug because it works and it's cheap. I mean, you can get it for like $4 at Walmart or something like that. And it still works. Metformin. It's not for everybody, but for those that it is, it's a wonderful medication. But metformin blocks B12 absorption. If you don't have B12, enough B12, your nerves are also going to get damaged. So this is why many times we prescribe the B12s or B complex type vitamins to make sure you have the necessary ingredients to maintain healthy nerves. All right? Vitamin D, I'm glad you asked about that. If you are a New York resident, not just visiting from somewhere else on vacation and had nothing to do in this wonderful state but to come here to this hospital and listen to me, then you will have some vitamin D deficiency. It's almost a given. Why? Because days are short. And when shorter days come in, we're all bundled up. And most of us work indoors, so we never get any sunlight. Where is vitamin D manufactured? In the skin. So if you don't get enough, it's going to be low. At the assisted living place that I'm at, I had every resident that became my patient checked. 90% of them had low vitamin D. Vitamin D is not just for strong bones. It also will boost your immune system. Vitamin D, and I collect all data in my personal library on all my journals. I have about 6, 7 journals that I receive. Anything on vitamin D, that gets torn out, goes into my private library, the rest I chuck. Unless there's something of interest there for me. Now, there was 2 studies that were very interesting, and that was patients who live in assisted living place. That means they can still do for themselves, they just need some assistance. When they have a mini mental exam to see how well they're doing cognitively, those that had low vitamin D those that had low were the ones that performed poorly on the mini mental exam. Those that had near normal to normal performed the best. So now we know there's an association between brain function and vitamin D. Now, I have no desire to develop dementia, so I'm taking vitamin D. I need to preserve my brain power. And I want to preserve for as long, because I enjoy what I do. And I'm hoping that if I'm forced to retire one day, that I can volunteer somewhere. But I want to do this until I drop dead. Oh, you got vitamin D deficient. And I die. That's it, right? But take it. Take up 1,000 international units on a daily basis, more so now that the days are very short. So even if you were out there, you're not going to get enough sun exposure. So take it on a regular basis. Someone raised their hand here, right over here.
This is a very interesting lecture.
I'm glad you enjoyed it.
Yes. Where did I get insulin from? Is that artificial? Where do they make that?
Oh, wow. Interesting question. At one time, it was coming from cows and pigs. That's where the bovine insulin and porcine for pig. Nowadays, we don't use it anymore. What we use is recombinant DNA. So we have bacteria that are actually, their genes are manipulated to produce human insulin, basically. So what you're getting is really a human recombinant type insulin.
From a live creature?
From bacteria that produce it.
In a lab.
In a lab.
I notice a lot of times if I don't walk a lot, that my fasting sugar will go down a lot more quickly during the course of the day than overnight. Does that mean definitely there's something wrong if it's not going down as well overnight?
Really interesting question. What happens is as follows. When you walk, and forgive me for making it so simple, it's not to insult anyone's intelligence. I do it even if I have a physician who's a patient of mine, because I know they're not an expert in what I know, and they appreciate it. So I speak very vernacular. So let's just think of these wonderful mechanisms we have in the body, and their job is to send these glucose school buses to pick up all the glucose children that are running through the blood veins, blood vessels, that can't get into a cell, right? If you think of the word insulin, in cell, that's where the glucose got to be inside the cell in order to be of any use. If you have diabetes, it can't get in that cell, but there are mechanisms that you can do. Walking actually opens up a different pathway where these school buses come in, pick up the children, which are the glucose, bring them into the cell. This is why when you exercise, many patients who are very sensitive to exercise will say, wow, it drops very nicely. But sometimes it drops too much, an hour or two later, because this mechanism is still working efficiently. For others, it doesn't work that well. For others, what happens is as follows. They'll tell me, Doc, but I didn't eat anything last night. I woke up with sugars that were so high. I can't understand it. Very simple. If your sugars are dropping in the middle of the night because of that exercise, your brain will detect, uh-oh, we're in trouble, it's going to drop, this guy is going to pass out on me, therefore let me call the liver, galang, 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 send out glucose. The liver, think of it, it does a million things, but think of it as a warehouse for sugar. and the liver will pour it out, and pour it out, and pour it out, so you wake up with a high glucose in the morning. Only when it drops that badly. Not for everyone. Some patients just have too big of a snack at bedtime. It's more like a meal, right? Doc, as a matter of fact, it's interesting that patients, we all have a different way of gauging what's a lot and what's not. At the office, I had this one patient who was gaining weight every time I would see her. What's going on here? No, doc, if you ask my husband, I eat like a bird. And I eat very little. Well, she was right the way she was describing it. She eats very little. My wife is doing the blood pressure, and my wife says, you know, I do also have a weight problem, but I know what my problem is. And my husband knows that. It's just, I enjoy eating. And that sort of made the patient feel, well, I can lower my guards too. If the doctor's wife says she enjoys eating, well, guess what, Mrs. Ortiz? I enjoy eating too. It was so amazing. And then my wife says, well, what do you have for breakfast? He says, I just have cereal. That's it, just a bowl of cereal. I can't understand that. And my sugars, well, what do you have with that cereal? Half and half. She was having a cup of half and half. I can't imagine. It's like eating a melted quiche or something. That's what she... Can you imagine? I think a teaspoon of that has about 90 calories, and she was having a cup of that with her cereal? That's when my wife says, well, you're doing the wrong thing. Why don't you just have, you know, either 2% or skim milk or sort of gradually into it. But you can't have it. She had no idea. But she was right. She was just eating that little bowl, right? So we got to be very careful.
Does diet soda also raise your sugar level?
Does diet soda raise your sugar levels? Rufia, I don't know, maybe you can answer this one.
I've been getting a lot of questions regarding to that. I am reading a book by, well, actually, I've read it. Dr. Daniel Amen, who's a psychiatrist, is doing research on obesity and brain, change your body. He says that effect, you can all go read, if you can Google him, that artificial sweetener also affects the blood sugar. If you do too much, you know, there are people who drink a liter of diet soda a day, or they use 4 packets of Splenda in 8-ounce cup of coffee.
Wow.
It's sugar alcohol. Okay?
It's a good way to have diarrhea, too. If you put that much Splenda in. The inositol, that's sugar alcohol, can do that. So you got to be very careful. Also, the other thing that, and there's at least 2 studies just recently in the last 3 months, New England Journal of Medicine, concerning this very issue, this question. And there was actually not as much weight with the sodas, regular sodas. This was done in a pediatric population. So there was more weight gain with the regular soda than there was actually with the diet soda. But again, there's a lot of conflicting studies out there. Some will say that, yes, you do gain it. And these were just 2 recent ones that said, well, we didn't really see that in the pediatric population. I would take, I have an opinion, but opinions is like, you know, we all have one, right? Who cares? But sometimes what happens also is because we're having a diet drink, we figure we can make up, you know, I'll take an extra hamburger, you know, make it a triple quarter pounder, because I am having a diet soda, right? So that's where it comes in. So you're still consuming as much, thinking that, well, I'll make it up, you know, by drinking this. Then you're still defeating the purpose of having that diet soda. So.
On one of the slides, it said something about like raw kale, raw spinach, and things like that. Why is it raw versus cooked like in soup or?
Oh, wonderful! Excellent question. A lot of the nutrients, we cook them away, unfortunately. It changes. Heat will change anything. Take this rug, burn it up, it will not be a nice rug anymore. Same with food. You can cook away the nutrients. Nothing beats eating something natural, per se. I'm not talking about, you know, organic and so forth. That has its values as well, but I'm just talking about natural. If you lightly steam it, it may not be that much, may not lose too much. But when you cook them, you're going to lose a lot. I don't like cooked spinach anyway, so I like them in salads. For me, it's where I derive the most pleasure. I mean, my wife will make me sandwiches with that instead of lettuce, only because it's more nutritious. it's a good source of iron as well. So if someone has some anemia, for example, and they happen to be vegetarian, well, it's okay. Continue being vegetarian. We can still get the iron from raisins, for example. And gram for gram, it's almost as good as having lamb, so to speak. So the dark leafy vegetables, excellent source of that, besides the other minerals and stuff that it has. But you don't want to cook them, denature them, and then they're of no nutritional value to you. I don't think you lose everything, but you're going to lose a good amount of it.
Now, is there a big difference between baby spinach and regular spinach?
I don't know. That would be something maybe that falls.
It's just the texture, really.
One goes, wah, wah. No. I don't know. I don't know.
Maybe I can help you. It's just that when your spinach starts growing, it has small leaves. And if you pick it then, that's your baby. And if you let it grow, it gets older and the leaves get rougher.
But probably your question was more in as far as nutritional value, right? I don't know the answer to that.
No.
No, right?
Same as spinach.
Same. Good. So wonderful, because that's what I've been eating, the baby spinach.
Cost more.
You talked about the benefits of drinking a lot of water. What about plain seltzer?
Plain seltzer. Wonderful. You know, it's interesting how we like to change things a little bit, thinking we're going to improve it. For example, nature gives you the apple. Well, you know, I need an apple pie, so I got to put in some syrup and sugar and so forth. It's not the same nutritional value. Plus, we remove the skin, the pectin, where most of its nutrition is at. So we lose a lot of things. Water by itself, and I call it unadulterated water. That's exactly how you want to drink it. Nothing bubbly about it, no phosphates in it that can cause some stones or cause your bones to have to buffer things by releasing some of its minerals as well. So nothing beats it. Now, I'm not saying don't have it. If you enjoy it once in a while, that's fine. Just to end here, because I think we ran out of time and we're going to be evicted right now. But I'm going to end with this. Just recently, I had my cousin who called me from Virginia. His in-laws were visiting from Venezuela, and he says, you know, his wife was saying, you know, Robert, please, can you see him? He's got diabetes, his kidneys, his eyes, his this and this and that. They're going to be here for about 6 months. You know, we'll take a trip up to New York. Fine, bring him over. So they came in. I looked at all the labs. We requested some labs prior to him coming in. Long story short, I says, you guys are doing a wonderful job with him, but you're sucking the joy of life from this man. 70 years old. He's about 6'3". He had this very sad looking, still a strong man. Why? Because everything that he enjoyed in life, his wife and daughters, everyone educated in this family. I mean, we're talking, you know, university teachers, psychologists, everyone highly educated, but Dad, you can't eat this. Honey, you can't eat that. So life was worthless. So I basically said, all right, this weekend you're staying at home. My wife is not cooking any special meals for a diabetic. So what I want you to do is as follows. You're going to offer him a little bit of everything we serve. Let him decide if he wants it or not. That includes desserts. Guess what? They're looking at me like, I don't know if we should have made this trip to New York. You know, he's going to ruin everything. Dad is going to die. So they come home. First day, we had wonderful pasta dish, whatever it was, he's enjoying. And then dessert came by. So the daughter looked at me like, and I winked at her, yes, you're going to offer him. Dad, would you like some? I'll take a little bit. He made the decision. He had a little bit of everything. When he woke up next morning, sugars, 99. Saturday, we had a little bit of everything. Again, he was offered. This time he said, no, I don't want that, thank you. But guess what? Saturday night, we had pizza. Oh my God, endocrinologist is eating pizza. We had pizza. He had a slice of it, and I don't know what else he had. Next morning, glucose, 104. Excellent. So I was telling him, you see the difference? Offer him. It's human sizes, human portions. Allow him to enjoy life. Make sure he's walking. Now we're going to meet him down in Pittsburgh for Thanksgiving. And the same thing, you know, we're pretty much following everything. He's doing very well. He's exercising. He's doing marvelously. I says, good, I'll be there for Thanksgiving. Anything happens, you know, I still know my CPR. Don't worry, you know. Yeah. The thing is, he's enjoying life. This is the way diabetics should be enjoying life, right? human portions. So with this, I end. Thank you so much for being so patient. Really appreciate it. Thank you.
Thank you so much. That was beyond amazing. We're being there, sitting back there saying, yeah, we need more time with him. I really appreciate you coming. And you'll hear more about other part of the lecture series that we'll hopefully reschedule. But it's so wonderful to have that information and a local resource for all of you. So
thank you, doctor. I'm going to say again,
Thank you.
thank you.
Thank you. Thank you.